Hi guys, welcome back to my channel. So today we are going to get a little bit into anxiety disorders, and we are going to start with the first anxiety disorder we're going to talk about, which is generalized anxiety disorder, also known as GAD. The simplest definition for generalized anxiety disorder, or GAD, is chronic debilitating nervousness. People with generalized anxiety disorder experience chronic and pervasive anxiety. Typically, they're feeling tense or worried all the time. This can cause a lot of distress and interfere with daily life. These can also be physical symptoms, so they can sometimes get stomach aches or headaches at times, and their anxiety will not be limited to a specific situation in the way that many people know about phobias, which we will eventually talk a lot more about in this series. Instead, it kind of pervades over almost everything, and it really does pervade over most aspects of their life. And this can come in the form where many do anticipate some form of disaster, or they may be over concerned about money, health, family, and other just common life aspects. Many people with GAD generally feel as though they don't know how to stop the worry cycle. So it just kind of continues, even though they may realize that their anxiety or their worry is a lot more extreme or intense than what the situation actually warrants. Really, all anxiety disorders relate to the sense of uncertainty and relate to the fear when it comes to uncertainty. So many people with GAD will attempt to control their environment, control the situations around them, or control what's going on. This kind of control can come in the form of over-planning many things. People with GAD are going to be really organized in the sense that if they can plan something to limit the amount of uncertainty, they're going to plan it out completely. So in regards to prevalence of this disorder, the lifetime prevalence is estimated to be about 5% of the population. GAD affects about 6.8 million adults in the United States alone, and women are twice as likely to be affected by this disorder. The risk is highest between childhood and middle age for people to be diagnosed with GAD. As we talked about previously in my first video, I kind of referenced the DSM, which is a wonderful little book of all the diagnostic criteria for this field of abnormal psychology. And when it comes to diagnostic criteria, a lot of it can be very specific, and parts can be very generalized. So before I even get into what the diagnostic criteria are for generalized anxiety disorder, I do want to mention the simple fact that many people and many of you are going to experience mental illness, as I said before, and can essentially compare yourself to a lot of what we talk about on this channel. And I do want to say that based on what I am going to talk about when it comes to diagnostic criteria, if you have experienced any of those diagnostics and you are essentially self-diagnosing yourself, I just want to ask you to, instead of self-diagnosing yourself, to please go see a therapist, a counselor, a specialist, a case manager, anyone that could possibly help you. A quick Google search is a perfect way to find someone in your area. I might post some links in my description if any of you are interested in getting help. And one of the biggest things is I do ask you not to really compare yourself. I know that's hard. I know that's hard for a lot of people. It's hard for me not to compare myself just to like general things. So a lot of this is going to be stuff that maybe you experienced, or is going to be feelings that maybe you have felt. And when it comes to the reality of this, I do ask that, you know, if you are worried about your mental health, if you do think that you may have a disorder, or you do think that you may have a problem, please go talk to someone about it and find out and really do investigate, because it can definitely help your life. And even if you don't, it is good to have a therapist just to talk about things. So now getting into the diagnostic criteria for generalized anxiety disorder, there must be pervasive anxiety for at least 6 months. So you have to have basically anxiety that pervades over your whole life for 6 months. You have to literally be anxious for 6 months. It can't be, I was anxious for 2 days here and 2 days here. You're going to be anxious for 6 months. And on top of that, it has to be difficult for you to control your anxiety. So many people, when we get anxiety, we're able to calm ourselves down in a way, and for some people with GAD, that's not as easy and not as possible. Many people with GAD don't really have that privilege to the same extent. The anxiety includes 3 or more of the following symptoms as well, which is restlessness, fatigue, difficulty sleeping, difficulty concentrating, irritability, and muscle tension. The anxiety warrior physical symptoms have to cause significant distress to the person with generalized anxiety disorder. And with that comes a certain level of impairment with normal functioning. So, you know, these effects aren't going to be due to any form of medication, any drug, or any other medical condition. So now you must be wondering what the cause of GAD is. And you're going to find a lot in this series that many of the causes for mental disorders are virtually unknown, or there's no real direct cause. So the cause of GAD is unknown, but there is evidence that biological factors do play a role, such as genetics or having a family history of anxiety. And life experiences, particularly stressful ones, can also play a significant role in whether or not someone develops generalized anxiety disorder. For people with GAD, when their symptoms or anxiety is mild to moderate, or they are also receiving treatment, many of these people can live healthy, wonderful, socially active lives and also be gainfully employed. So many people with GAD can have wonderful lives. They can live good lives, and the disorder is definitely debilitating for some, but many can actually live productive lives, especially if they are receiving treatment. But some people can still have an excessively hard time doing even the simplest of tasks on a day-to-day basis when their anxiety is severe. Essentially, GAD is rarely ever by itself, and these co-occurring problems, illnesses, or disorders that someone with GAD may have will also need separate therapy and help for those issues as well. Some of the other disorders that may be comorbid with generalized anxiety disorder is going to be, you know, other anxiety disorders that we'll talk about in the next few videos, depression, as well as substance abuse. And many times you're going to hear me talk about how substance abuse is going to be comorbid. And one thing I do want to mention is that for many people with mental disorders, if they're not getting proper treatment and proper medication, it's going to be pretty common to see comorbidity of substance abuse as a way for them to control it. So many people with GAD may engage in substance abuse to relax or calm their anxieties so they can lead productive lives. So when it comes to therapy and treatment for people with generalized anxiety disorder, there are multiple different approaches that can be taken. One of these is CBT, which is cognitive behavioral therapy. And research has shown that it is pretty effective for people with GAD, and CBT has also been modified for children and teens. Supportive and interpersonal therapy also is very helpful for people with GAD. There's also mindfulness-based approaches people can learn about and go to therapy for. There's also acceptance commitment therapy that helps with GAD. In regards to medication, many people with GAD are most likely going to be taking SSRIs, and this can usually be with or without therapy. Most research and studies do show that the best way to deal with a mental disorder is to use a mixture of medication and therapy, where you're going to therapy while you're also being medicated. And part of that is because the medication will take care of a lot more of the biological issues when it comes to disorders. We had talked about it in the last video, how brain chemistry can alter emotional responses. Therapy helps with the behavioral cognitive aspects of it, typically, especially if you're doing CBT, and that can deal with your thoughts, which is cognitive. That's the cognitive aspect, is your thoughts and how you think of yourself and the world around you. And then your behavior, which is how you behave and how you behave towards the world around you. This is future Becky. There was some more things that I wanted to add in discussing this. Unfortunately, earlier I kind of got cut short doing my whole recording. I don't want to say replace therapy or replace medication, but there's other kinds of treatments that people can add into their daily life that helps with generalized anxiety disorders as well as other anxieties. And that can be yoga, exercise, meditation, relaxation techniques, stuff like that that really can help. Thanks so much for learning about generalized anxiety disorder with me today. I hope you guys learned a lot. Like, comment, and subscribe. Next Monday, we will be talking about panic disorder and continuing with the anxiety disorders. Bye, guys.